Let's take professional and community relationship building to the next level. You're listening to the PHEC podcast, episode 376. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. If you've not heard episode 375, the one right before this one, then please take a moment and check it out. I shared a personal story and takeaways from an experience with our plumber. I know it seems like a very odd connection, but I think you'll find it very insightful and hopefully inspire some good thought and conversations with your colleagues. On this episode, I'm going to share with you some of the ways that we're putting those lessons that I talked about in that previous episode into action within my own team. Now, let me briefly introduce myself. And just in case you are tuning in for the very first time, I'm really happy that you're here. My name is Dr. Huntley, and I lead a public health and epidemiology consulting firm that supports large nonprofit organizations and government agencies that serve BIPOC communities. We help our clients communicate their health data and information in plain language to communities that they serve. If your organization serves BIPOC communities, then please reach out to us through our website, DrCHHuntley.com. We'd be really happy to meet with you and explore how we might be able to support your organization. The links to our website will also be provided in the show notes. Now, during the week that this episode is released, my team and I will be attending the American Public Health Association's annual meeting, and we'll have a booth in the exhibit hall this year. So my big takeaways from the previous episode and plumber story, spoiler alert here, they really revolved around the importance of trust and genuine relationships with communities that we serve. So here are some ways that we're putting these lessons from that last episode into action. At the conference, I'm joined by two of my team members. You're familiar with Laura. She's helped support this podcast for many years, part-time. She became full-time this year. And also Amber. And if you have been a part of any of our entrepreneurial support programs, then you've engaged with Amber in some way. If you've attended the expo in person or online, you've engaged with Amber in some way. They're going to be joining me at the conference and we'll be at our booth there. We have, like I said, some of the ways that we're wanting to engage in putting these lessons and takeaways in action is that we have some special gifts to share with those who stop by our booth and meet us and want to learn more about what we do and share with us, about what they do. We have special gifts for our clients who will be there. A lot of the clients that we serve through our consulting firm are also going to be there and have booths at the conference. Some won't have booths, but I know at least 2 or 3 of our clients will have booths. So we have some special gifts to kind of surprise them. We get to meet and engage with them in person there. We are genuinely excited to connect with folks in person that we've only engaged with online so far. And we've mentioned this in previous episodes. We want you to stop by our booth and let us know that you've been listening to the podcast. We really want to meet you. We want to connect with any podcast listeners who are in attendance. We are going to be taking pictures, having conversations, being present with all of you who are able to stop by our booth. That is important to me. It's important to our team. And I want to make sure that you all are aware of that. We encourage you to stop by. We want to talk with you, engage with you, share gifts that we have with you while supplies last, I should say, and take photos and I want to hear what you like about the podcast. If you have ideas for a topic or a guest to recommend. I just want to engage with you in person at this conference, as many of you as I possibly can. So we want to build up those relationships that started with this podcast. If you're going to be there, it gives us an opportunity to take that relationship to another level by engaging in person. So don't be shy. If you're not going to be in attendance, or if you hear this episode after the conference and you didn't get a chance to stop by and meet with us in person, then please be sure to click the link in the description of this episode to subscribe to our podcast email updates list. So that means there's a link in the description for this podcast episode where you can grab a free 10-page guide, which is sort of an introduction to the podcast. It's an ebook that we created. Once you opt in and receive that, you're automatically subscribed to our email list, and you'll start receiving updates from us about new episodes. And that the reason that's important is because it is our plan soon after the conference time to host a virtual event, a virtual meeting, where our fans of the podcast can come together and just engage with us in this virtual space, probably a Zoom meeting. And we want to make sure that if you're listening and you really enjoy the podcast and you didn't get a chance to meet with us in person, then this will be an opportunity to join us for this virtual meeting. But you'll only know about it by, being on our email list so that you can be invited by us to join. We really want you to know that we are sincere about building genuine relationships. And we look forward to engaging with you in person and in the virtual meeting if you're not able to join us in person, just to take those relationships to a new level. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.